Hello, my name is Dr. Alyssa Swick with the Indiana Complex Care Coordination Collaborative with Indiana University School of Medicine. I'm here to talk to you about how to make a plan for your health at the end of each visit with your doctor. You and your doctor start a visit by talking about your health. Then the doctor does an exam. The last part of a visit is finding out what the doctor thinks about your health. The doctor might tell you that you have a new diagnosis. A diagnosis is the name of an illness. It can explain symptoms you are having, or it may be something that the doctor learned from doing your exam. For example, if you have headaches and your blood pressure is high, then the diagnosis is high blood pressure or hypertension. The doctor may tell you to take a new medicine that will help. Sometimes you need to get a test or see a specialist. The doctor may ask you to work on some new health habits. The doctor may tell you a lot of things. Some doctors will be good at explaining in a way you understand. Sometimes you might not understand the first time. You may need to ask questions. You need to decide if you agree with the plan. Do you want to start the new medicine? Do you agree to have the next test? It is okay to ask about other choices. You can ask the doctor to use easier words, to talk slower, and to go over everything again. You can ask the doctor to use pictures to help explain. You can ask the doctor to write everything down so you can bring it home and go over it with a helper. You may want to ask the doctor to talk to a helper by phone. You can also ask the doctor for other ways to learn more about your health or diagnosis, like handouts, websites, or videos. Some patients like to use an after-the-visit worksheet. This Aspire worksheet was made by doctors at a university in Oregon together with adults with autism. Some patients would rather use a simpler form, like this one from the UCSF Office of Developmental Primary Care. You can print out the worksheets from our website, forourhealth.org. Here are some usual pieces of the plan. You may need to learn about a new diagnosis, make a follow-up appointment, make an appointment with a specialist, do tests like a lab or x-ray test, take a medicine or change your medicines, work on a health habit at home, get help after a visit. Let's talk about each part. Getting a new diagnosis can be helpful. If you have been feeling ill and you now know the reason why, that can feel hopeful. It might relieve a worry. But a new diagnosis can also be confusing or scary. You may have a lot of questions, like, what does the diagnosis mean? Are we sure of the diagnosis? Or do we need to do other tests to be sure? Will it get better with treatment? Will I start treatment now? What should I expect to happen with the treatment? How can I learn more? It is a good idea to have some websites that you can use to learn more. You should use websites that you can trust. See our website, forourhealth.org, for links to some of our favorites. They are Mayo Clinic Diseases and Conditions, Cleveland Clinic Health Library, Nemours Kids Health,